Hey guys, so today we're going to talk about some research that's recently come out on the relationship between exercise and low back pain. So should you exercise if you're dealing with chronic low back pain? Because, honestly, dealing with something like back pain or low back pain can suck. I've dealt with it before. I'm sure a lot of you have as well. So you may think, I'm doing more harm than I am good, so you stop it altogether. But let's dive in and look at what the research says here. So we're going to look at a couple studies that came out, and both of these are systematic reviews. So just to kind of review what those are, if you are unfamiliar with them, systematic reviews are the highest quality of evidence that you can get. So they go in and they critically appraise all of the relevant research out there. They analyze the data, and they have specific criteria that has to be met. And so from there, they pull all of the studies that were done at the highest quality to be included in this one systematic review. And then they, analyze that stuff, and in order to come up with an answer to the topic or whatever question is being asked. So this first study here just came out this year, actually. So it was a 2021 systematic review, and it looked at different pharmacologic and non-pharmacologic interventions and treatments to see which ones had a clinically meaningful response in patients who are dealing with chronic low back pain. So in this study, they found 63 randomized controlled trials that they included in this review with 15 different interventions. So there was, they looked at different medications, they looked at exercise, they looked at acupuncture, manipulation, injections, plus more. So what they found from all this is that exercise, SNRIs, which are serotonin norepinephrine reuptake inhibitors, and oral NSAIDs like ibuprofen, they all provided a clinically meaningful benefit. But exercise was the only one that provided sustained long-term benefits and reduction in pain. So this was up to 48 weeks after the fact. So that's a pretty significant finding and result there. And then looking at this other study, this was a 2020 systematic review, and this one looked at the effect of, or the relationship between stabilization exercises and its effect on patients who are dealing with, again, chronic low back pain. So with this one, there were over 3,000 studies related to this topic, and they only used 50 of these in this review. So they have a pretty strict criteria that has to be met in order to be included in this systematic review. And so what they found with this one is that core specific stabilization exercises performed with a training time of 20 to 30 minutes per session had the greatest effect on pain and disability. Now, there's still some debate on the number of times per week that it should be performed. It's a little bit unclear still, but right now the current recommendation for that is 3 to 5 times per week. So, from these two studies here come out very recently, and there's pretty significant findings there that exercise can absolutely help with low back pain and, chronic low back pain especially. So just a couple kind of final, pointers here. Number one, there's tons of research out there, tons of studies, but just make sure that, if you are doing research, you're looking for the highest quality research, especially when making decisions about your body, your health, whatever it may be. Don't just take, somebody's word for it just because they said it. Don't necessarily take it for truth. Do your own research. And then number 2, don't discount exercise if you are dealing with chronic low back pain. Hurt doesn't always equal harm. Exercise can be very beneficial, but always, please consult, get the advice from a healthcare professional to get the best recommendations for your specific situation. Everybody's unique, okay? So I'll link these studies in the description below if you want to take a look at them for yourself. And then kind of going forward here, we're going to dive deeper into some exercises, some core stabilization stuff in some upcoming videos. So be on the lookout for that. Let me know if you have any questions. I hope this helped, and we will talk to you guys soon.